Primary healthcare utilization is the most activity-related problems. It is a consumer-oriented policy with diverse dimensions in needs, perception, and knowledge. As for the overview of facility and population control, is why we are here today. I am Olujoke Musako on Let's Talk, and my guest is Mariam Usman, a presenter with Ogun State Television. The topic is primary healthcare utilization among the populace. Hello and welcome. But before we delve into the program proper, I would like to remind you, as usual, to please subscribe to our YouTube channel and follow us on all of our social media platforms. Thank you so much, Ms. Usman, for coming on the show. It's indeed a great privilege to have you here.
Thank you so much, Jessica. Pleased to be here.
Okay. Please give us an overview of what primary health care is all about.
Primary health care is literally not new to anyone listening or watching me right now. I mean, at some point, we either have, been benefited from this system, or we kind of have seen it one time or the other while we grew up and all that. But for the sake of our discussion today, I'm going to say primary health care is the first level of contact for individuals, family, the community at large with the nation's health system. Now, this is all because to provide solutions to health problems in the community, to promote health among the populace. Now, this is the structure that was created by the federal government to help tackle health challenges, especially in rural areas. Now, I'm going to be talking from my country's point of view, which is Nigeria. It is what I literally know. So I'm going to be laying more emphasis with Nigeria. So you have to pardon me if I do most of that from Nigeria. So the primary health care generally is said to have 8 major components. This component makes up the health system, the primary health care system. Now, I'm going to start with the public education, and we have the proper nutrition, clean water and sanitation, maternity and child health care, immunization, that's a very common one, the one we know very well. And we have local disease control and accessible treatment, yes. Then the last one is drug abuse. So for the sake of time, I'm just going to, lay emphasis majorly on public education and promotion of food supply and proper nutrition. So you see, this primary health care, like I said before, is the first contact of health personnel with communities and individuals in a particular community. So the first thing that I would say is the major or the starting point of the healthcare is providing primary education about health as a whole. So you see, when you visit a particular community, for instance, it's almost impossible to say you can't trace a particular health center there. This is because the governments are deliberate and taking care of the people in a particular location. And it is this primary health care that provides this education, because you can't have the health system at the federal level or the state level to come closer than the primary health care. So they provide this education, and I would say it comes in forms of awareness. So educating the public on prevention of diseases, how to protect themselves, how to, generally create awareness about certain health conditions is a sole component of the primary health care. It also involves motivating people to adopt and maintain healthy lifestyle to make people have value of their health. So it all boils down to the communication, right? So this public health care is supposed to be able to communicate health to these people in the language they understand. And that's why I feel like it's a major component. Now, the second one I like to emphasize on is the promotion of food supply and proper nutrition. You'll agree with me that you are made up of what you eat. So if you're going to take care of your health, you need to pay close attention to what you eat. Now, how do you pay close attention to what you eat when there is no food security? And food security starts with the availability of food available for consumption, probably for a year or thereabouts, which involves production, manufacturing, preservation, storage, and all that. Now you might be wondering, how does this come in place? How does this make a component for the public health care? So if you read on statistics, you find out that in the developed country, no, the underdeveloped country rather, and the developing country have a common problem when it comes to health. They have a lot of problems in common, and one of the problems is malnutrition and undernutrition. Now, the primary health care is a deliberate scheme by the government to help tackle this challenge, and that's in the form of providing food, providing nutrients for the populace, for these people to benefit from. So it's just unfortunate that we have in some part of the world where some people don't really believe that, and you might not really blame them because some governments are not really loyal to this thing. But it's also part of what makes a good health system.
Thank you so much for that. Now, let's quickly look at the quality of healthcare services across the globe.
The quality of healthcare currently across the globe differs with the particular country. I give you an instance. Countries like Denmark, Taiwan, South Korea, France, Japan, they're currently leading the world with the best primary health care. And you will agree with me that these countries can be categorized under the developed countries. So I'm going to say that the quality of healthcare services around the globe differs with the kind of country in question. Some countries are literally struggling with this. I'll give you an instance. In Nigeria, the utilization of primary healthcare is poor, very, very poor. And you could say it's as a result of certain factors, such as the economical factor, the social factor, but notwithstanding, the utilization in Nigeria is very, very poor. And the healthcare encompasses of a lot of things. It includes medical doctors, hospitals, dentistry, psychology, nursing, therapy, available treatment, drugs. Now, these are some things that some developed countries have put in place. Some developed countries are no longer lacking in providing these things. But I'm going to tell you with facts that it is almost, let's just say, a little percentage of that is possible in Nigeria. So come to a particular primary health care center and you see a dentist, a therapist, a medical doctor, a nurse. So it's almost like one of the challenges that on the developed countries and developing countries face. So in terms of the utilization, I'm going to say the developed countries are utilizing public health care better than the underdeveloped or developing countries.
Okay. So, what about utilization among the populace? Looking at it from the angle of facility and population control.
All right. So again, I'm going to say the utilization generally from developing and underdeveloping country is generally poor. And I'll be focusing on why it is so. Why is it poor from the developing and underdeveloping countries? I'm going to tell you that primary health care has competition or a lot of alternatives that the populace use in place of healthcare. So In some communities, you might visit where you see primary health care. You see some communities have much of the herbal medicine. The typical African setting believes so much in the power of herbal medicine. And then, of course, we have the spiritual healers. Those are the ones that, treat treat patients with the spiritual means. And then we have the self-medication as another factor that is challenging the utilization of public health care. We have a lack of funding. And so some hospitals, you go to some of these hospitals and you find out that there's almost nothing there because there's no funding from the federal government. So in a situation where a particular hospital is not properly funded, you see that the populace will not find the need to to patronize that healthcare. And we have lack of manpower. But I'm just going to lay more emphasis on herbal medicine, spiritual healers, self-medication, and lack of funding. But these are what poses a really serious challenge to healthcare. Before now, I said the factors limiting high risk healthcare could be categorized as the economic factor or the social factor. The social factor now is the herbal medicine. In a typical African setting, we believe in the power of going to the mother nature, pick whatever is there, and to be frank, it really works for us. Sometimes it works, and sometimes it's beyond what we can really understand. And so some of these populists have literally believed so much in this that they are not ready to take whatever offer that comes with the primary health care. And so you see some hospitals, some primary health care, they might even have these facilities, but nobody is patronizing them. That's because of the cultural belief, what they believe to be stronger. So you see, when you now talk of utilization in developed countries, I'm going to tell you that they utilize it very well because they know the uses of vaccine. They know how it can help you. I give you an instance. When the global pandemic, or I mean COVID-19 started recently, when it started around last year or thereabout, not every primary health care was able to provide treatment immediately to the populace. In fact, in Africa, we had our alternatives. We had the herbal medicine. There was this particular African country that literally cooked herbal medicine, and people were coming inside to take. And before you know, the test was negative to the virus. And so you see, these are what poses threats. But in some developed countries, you see them already going to the primary health care to collect their jab. They go for the test and they are negative, first-hand treatment and all that. But that setting, you can say that, oh, these populace are utilizing this particular thing. But on the other hand, the developed and the underdeveloping countries don't. And you see, when the underdeveloped countries and developing countries don't see the need, you begin to see that diseases that are quite curable might not be cured with these other alternatives that might likely lead to death of the populace.
Thank you so much for that. Let's quickly go on this break. When we come back, we continue from there. Please stay with us. Welcome back. If you're just joining us, the program is Let's Talk on DNTWOK, and I've been speaking with Mariam Usman, a presenter with Ogun State Television, and the topic has been primary healthcare utilization amongst the populace. So do continue with us as we enjoy the discussion. Thank you for standing by, Mariam. It's nice having you again.
My pleasure. My pleasure.
So, what are the problems compounding healthcare services and utilization?
Yes. So before we went on the break, I was, uh, you know, explaining some of the social factor rather. And I mentioned the herbal medicine as being one of the hindrances to public health because the populace, some of the populace from the underdeveloped and developing countries see these as an alternative to primary health care. So the moment there's an alternative, that alternative is putting threat to the utilization of primary health care and its objectives. And I did mention that we also have cases where there are use of spiritual healers. Some people are so spiritual that they believe treatment, some diseases or most diseases can be treated spiritually. And that has led to several deaths in underdeveloped countries and developing countries. So someone is probably having a fever or a malaria, and a spiritual healer thinks his own method of treatment is the best treatment for malaria. The primary healthcare, of course, would treat you according to doctor's prescription and whatever the test brings up. But the spiritual healers don't see it that way. So there are cases where patients have died in the past as a result of spiritual healer decided to treat their patients spiritually for treatment that should be treated with just the medical way. So this has also posed threat to the utilization of primary health care. Now let's come to uh, lack of funding. That's like the economical part of the factors um, fighting against the utilization of primary health care. So lack of funding in the sense that the primary health care was generally created to bridge the gap of inequality in regard in regarding to treatment or health getting health treatment. So in the society we have the rich, we have the average, and we have the poor. But that does not mean we should not all have access to health. We should all be treated because at some point in time we are sick. At some point in time we need to be treated. Now this is where the creation of the healthcare system by the government. So if you cannot afford a particular treatment, the government of this particular country should be able to provide you something affordable. Now, some of these governments have failed in their own path of funding this project. So you go to some underdeveloped countries or some developing countries, and you see the first contract of health treatment seriously lacking behind. How can this primary health care achieve their aims and objectives? How can it be utilized in full definition? So when I say countries like Denmark, Taiwan, Korea, South Korea, France are leading with primary health care, it's because they've understood the importance of this and their governments are committed to providing these services to the populace. Now, not much of that can be traced to developed countries and on the developing countries. So you see, this economic part is also a serious challenge. But again, it's not just the economic challenge, it's also the social factor limiting the utilization of the public health care we have around. And of course, you can trace that to the stakeholders in the community. I mean, like I said before, they literally some not in all cases, some will have everything in place. They will have doctors around, they will have drugs are available for them to use. In fact, there will be everything. But you see, this part of when you are glued to some superstitious belief, it could help if it could destroy a very good way of improving the health of a particular community. And that's why the public healthcare system as a whole cannot relent in one of the components I earlier spoke on, public education. There is need to create awareness of what this scheme can provide for them, what it can do for them as a person, and that involves communicating health languages in the language they understand. Since they are the first hand um, health service, they have to go to the extent of understanding health, um, the health problems of the populace and creating solutions for them.
Mm. That's really a great one to actually look into. So, what can be done to actually make this work?
All right, so I'm gonna draw your mind again to what I earlier stated. We must understand that the public health care was created or meant to aid in bridging the gap of the existing inequalities in the health status among the populace of a particular country or society. Now, the background in developed and developing countries is, is so much that while the developed countries are advancing with this particular topic, other countries are still being dragged back. Other countries are still crawling while they're supposed to be making progress. Now, when you talk about the healthcare system in a country like Nigeria, first of all, one major threat or one major factor challenging the public healthcare is lack of funding, especially in Nigeria. So we have the local government, which is supposed to take care of the primary health care at the local level. Now, we don't know how committed some of these local government chairmen, councillors are to this thing. Now, one of the ways we can cover this up, or one of the ways we can change the narrative, especially in Nigeria or developing countries like Nigeria and in the developing country, is policymakers need to improve the status of providing primary health care centers. So, as a government, you're supposed to understand that the people you are leading are your priorities. And if you're going to create a health center for them, then you have to be committed. You have to take their health as a priority. You have to create necessary funding. So when you send doctors to a particular community, you should see to that these doctors are well taken care of. Because it is when these doctors are happy that we can actually, provide services to the populace. And then you have to also ensure that the necessary equipment to help these medical practitioners practice their job or their work is is um, is very very okay. Okay, so in some scenarios in this case, you could just go to a particular healthcare and there's a particular instrument that is needed to conduct a test or carry out a particular exercise, but they can't because they don't have a particular equipment. And then that's when you see these scenarios where you have to be referred to either a state hospital or a federal hospital. Now, don't get me wrong, um, the local government or the primary health care at the local level is not supposed to have the whole equipment, but there are some equipment that are very essential that you must have in a place where you have a community. So government should really pay attention to the lack of funding factor limiting the use of public primary health care, because when you do that, people who don't see the need will begin to see the need and they start patronizing it. And then I'm going to talk about the images of the public healthcare centers should be improved by stakeholder by policy makers or the government in question. So you go to some healthcare centers, and as a person, you'll be discouraged to go there for a treatment. I mean, how can you trust this particular place to give you to treat your health challenge when the place in general is not looking is not even looking healthy? So some primary health care are just they're almost like an abandoned project because there's no renovation done. Sometimes they could be, you know, there could be some funds that are allocated to these hospitals. There could be cases of embezzlement, and it will reflect in every sector of every part um, of the primary healthcare. So when we are bringing in doctors that are good, bringing in treatment that are good, providing drugs and all that, we should also pay attention to the looks of the primary healthcare. That's the first image that anyone who doesn't want to use the primary healthcare would first of all see. So when this image is not painted good, I'm telling you, it would discourage a lot of people from using it and believing in the power of its services. And then the stakeholders also have a role to play in the utilization of public healthcare. So these things are provided to you by the government to help you treat your problem, to help you treat your health challenges. So you're not expected to give yourself self medication because you are not a medical practitioner. You don't know the nature of your sickness, the disease. You don't know how bad it has eaten. And unless you get help from experts, you might be treating a different disease while the other one is there and is eating deep. So as a community, individuals or families, it is very important that we see this provision by the government as a means of livelihood. We need to see it as an asset to boost our health in general. The World Health Organization has this statistics one time that lots of children die as a result of diseases that could be cured with drugs, of course, from the medical practitioners, from the public healthcare. But because some of these people are tied to understanding they can do this themselves, it has led to death of so many infants. So as a community, as a society, we need to see the positive side of the public healthcare and the primary healthcare and use it to our own good.
Thank you so much, Mariam. It's for that. It's been wonderful having you. We have to close now because we are quite behind our time. Thank you once again.
Thank you so much for having me. It was
All
such
right.
a nice time.
And to you out there, thank you too for being part of the show. It's Let's Talk, and we come with different topics. So enjoy this topic. I believe you did enjoy it. And if you want to watch it again, it will be nice to actually check it out again for you to actually get detailed information of what primary health care is all about. Until next time, when I come your way again with another topic, I remain Oluja Kemasako. Bye for now.